Okay, so poisoning series includes cannabis poisoning or marijuana poisoning. In this, when excessive cannabis are taken, and the patient will develop in low doses, patient will be euphoric. He will have altered mentation. Sometimes he will smile, he will laugh loudly. Having conjunctival injections can also cause this, and it is followed by relaxation or drowsiness. Patient will have hypertension and tachycardia. His pulse rate will be also raised, and there will be slurred speech and ataxia. In high doses, patient will have anxiety, confusion, and hallucinations. Psychosis, patient will shout suddenly without any cause. And the management includes ingestion. If ingested cannabis are given, it results into serious poisoning. While management is supportive treatment, which is required, the patient should be done gastric lavage, and he should be given some antibiotics, and flagyl and normal saline infusion should be given to the patient. So in this way, cannabis poisoning can be treated. And another poisoning includes benzodiazepine poisoning. Now, benzodiazepines are sedatives and hypnotics. When patient take excessive benzodiazepine, he becomes drowsy, depressed, and a sedative behavior will be shown by the patient. There will be rapid onset weakness. Patient will have ataxia, drowsiness, eye diplopic vision or nystagmus will be there. Patient will have respiratory depression when excessive benzodiazepines given, and there will be depressed ventilation. CNS depression is also there. Pupil size will be normal in benzodiazepine poisoning. Whenever patient comes to you with poisoning, you have to rule out whether it is benzodiazepine or it is organophosphate poisoning. In organophosphate poisoning, there will be pinpoint pupil, and in benzodiazepine, there will be normal pupil aperture. Management of benzodiazepine poisoning is patient should be observed for less than or for 6 hours post ingestion. Activated charcoal should be given, and fluminazole is a specific antidote for benzodiazepine poisoning. Fluminazole should be given in order to prevent the poisoning of the patient. Now, this one poisoning is cocaine. Cocaine poisoning includes cocaine stimulating agent of sympathetic amines, and the patient having cocaine poisoning having respiratory tachycardia, hypertension, anxiety, insomnia, hallucination, muscle tremor, eye dilated pupil will be there in cocaine poisoning, and there will be fever, pain, diarrhea, nausea, vomiting, and piloerection or dry mouth occurs in the patient of the cocaine poisoning. Complications will be there will be AMI, myocardial infarction, rhabdomyolysis means loss of muscles, renal failure, and intracerebral hemorrhage will be there in the patient. How can you manage the patient of benzodiazepine poisoning? So management includes there will be ECG observation should be done. Benzodiazepines should be given in poisoning or in cocaine poisoning, and aspirin or nitrates for chest pain. IV diazepam is given in order to prevent convulsions and agitation. Active external cooling for hyperthermia and cocaine poisoning, and beta blockers should be given. And paradoxical hypertension is also developed in the patient. So in this way, we can treat the patient of cocaine poisoning. And these type of poisoning are so harmful. A patient must be monitored and given extensive care, because there are a lot of chances for death in these patients. Opioid poisoning includes opioids are heroin, morphine, pethidine, codeine, or methadone, and oxycodone should be given. Clinical features in such patients will be respiratory depressed, hypotension, relative bradycardia, confusion, hallucination, slurred speech, ataxia, reduced muscle tone will be there, and pinpoint pupil in opioid poisoning occurs. Say signs of IV drug misabuse: needle tick mark. You have to look at the needle marks, and then management should be given. Airway should be cleared, respiratory support should be given, oxygen should be given to the patient. Assess the saturation of the patient continuously. IV naloxone should be given, and IV naloxone will reverse the respiratory depression, and patient will have, if patient has pulmonary edema, so non-cardiogenic support should be given, like diuretic therapy. Furosemide should be given in pulmonary edema, mechanical ventilation, and CPAP and PPAP should be given to the patient. So in this way, we can manage the patient of opioid poisoning, and we can treat that patient